The Big Pharma Lie. We're on life support after birth. Question. Have we allowed Big Pharma to control the narrative around the definition of health? The wisdom of ancient medicine has been replaced by Big Pharma. We may have lost touch with the wisdom of ancient Chinese and Ayurvedic medicine, but at one time these and others were the prevailing medical philosophies. Holistic medicine is one modern attempt to reconnect with these ancient philosophies. However, holistic medicine isn't perfect. It isn't a direct alternative to pharmaceuticals. However, we need to return to the idea that natural remedies can in some cases be just as worthy as pharmaceutical ones. Big Pharma has changed our view of health and wellness over the last 100 years. We've been convinced that at each stage of our lives we need to rely on some sort of pharmaceutical drug or pharmaceutical solution. A few examples come to mind. 1. Overprescribing elementary school children drugs for ADHD and other attention disorders, which some may deem to be normal childlike behavior. 2. Overprescribing antibiotics for mild infections or sicknesses, which can lead to antibiotic-resistant microbes developing. 3. Prescribing blood pressure, diabetes, and cholesterol drugs when in reality the person has a broken diet and exercise routine. 4. Vaccinating for ailments that we have the ability to overcome and develop natural immunity with proper care, such as the yearly flu shot. 5. Overuse of sanitizers which kill off beneficial microbes that help us develop defense and immunity against more dangerous microbes. Big Pharma versus integrative medicine. Quote, "Let food be thy medicine and let medicine be thy food." End quote. Hippocrates. These are all contentious topics. Don't misunderstand what I'm saying to mean that we don't need pharmaceutical innovations. What I'm trying to say is that we should be aiming to heal ourselves from the core, not to treat symptoms. I'm arguing that when natural methods fail us, then we should consider pharmaceutical interventions. Integrative medicine, or IM, is, in my view, a healthy and balanced alternative to pharmaceutical interventions. IM is defined as a form of medical therapy that combines practices and treatments from alternative medicine with conventional medicine. Integrative medicine aims to view a person as a unique individual. IM looks at a person holistically in that emotional, physical, and mental interventions are sought to improve conditions. Individuals are viewed as a whole rather than a set of predefined symptoms, and the root cause is found systematically. While this approach is great in getting to the root cause, it doesn't discount the utility of pharmaceutical interventions. It just doesn't lead with that like traditional Western medicine does. Solutions might come in the form of stress relief activities, herbal supplementation, dietary change, meditation, etc. To see a person as a symphony of interacting systems is important, and that's what integrative medicine aims to do. Unfortunately, integrative medicine is not the gold standard of treatment in today's day and age. Treating disease versus treating symptoms. Quote, "Before you heal someone, ask him if he's willing to give up the things that make him sick." End quote. Hippocrates. I once heard a great analogy given by Dr. Peter Attia. Imagine there was an epidemic of people running their shins into coffee tables. We would have a large group of people developing bruises on their shins. Now imagine if as a result of the bruising, our number one course of action was to cover the bruise with makeup. Would that solve the issue? Of course not. The true solution would be to teach people how to avoid hitting coffee tables. It's a shame that this is the analogy we use to describe modern-day medical intervention. The majority of people are convinced that our ailments are unrelated to our behavior. The majority of people neglect the root cause. We begin to lean on Big Pharma to supply us with the necessary drugs to cover our symptoms and pretend like nothing is wrong. Lifespan versus health span. Quote, "Practice two things in your dealing with disease. Either help or do not harm the patient." End quote. Hippocrates. The advent of pharmaceutical drugs has increased our lifespan significantly. In past times, a serious infection could have spelt the end of a life. These days, we don't even blink an eye at some ailments. Pharmaceuticals have allowed us to reduce the fear associated with certain conditions. However, just because we're living much longer doesn't mean that we're living years of health. The difference between lifespan and health span is that lifespan purely measures the number of years, whereas health span measures the number of years of vibrant health. It seems that Western medicine has arrived at a point where the masking of symptoms carries us forward to old age. The downside of this is that our health slowly deteriorates. We've been convinced that old age comes with loss of physical and mental ability. If we compare old age in the West to old age in the East, we can see a vast difference. Centenarians and supercentenarians are those aged 100 plus. In the East, these people maintain a higher level of health through old age. This would suggest that Eastern traditions have a better grasp on health span than we do in the West. Disaster capitalism and big pharma. Quote, "The slogan for contemporary capitalism, fear and disorder are the catalysts for each new leap forward." End quote. Naomi Klein. It's unfortunate that big pharma has led us here. A big reason why Western medicine will never focus on healing root causes is because interventions that mask symptoms and cause side effects are more profitable. Disaster capitalism is at the core of what keeps big pharma profitable. For example, drug A is prescribed for ailment X. However, drug A comes with its side effects, which are ailment Y, which warrants another solution, drug B. This domino effect is never ending. It's easy to see how overall disorder and chaos helps to keep the faucet of profitable opportunities running for big pharma. If they control the narrative, they control our health beliefs. This is where we need to educate ourselves in the effectiveness of alternative medicine. If you enjoyed this article, you can find more like it at www.banafit.com. That's www.banafit.com. Thanks for listening.